it? You have the remote which changes.
You have to buy one.
You have to buy it. Now the second one. All of you, I'm sure, like you are aware about the different techniques of breastfeeding. Inshallah, if you are a obstetrician or pediatrician, inshallah, a newly newborn baby, the mother comes to you, how to feed the breast, okay, how to feed the breast for the milk to the baby.
Yes. The questions also.
So it will be very common problem they come across. Okay. And what is the importance of breastfeeding, breast milk? What is the importance of advantage of breast milk over the formula feeding? Okay. And in the kingdom, you see most of the people, really.
It's the opposite.
If it is that, really.
Formula, they're using formula.
And
That's why the person has millimeters.
so all these things you should be aware. Now, what are the different composition? Colostrum, transition milk, mature milk, fore-milk, hind-milk, and preterm milk. What's the meaning of colostrum? Any idea?
Antibodies. After 3 hours, first 3 days.
So you do it first. So initially, okay, the thick yellowish milk secreted the first several days after delivery, up to 7 days. This is the most essential. Some of the mothers think like this is more thick and yellow. It's not good for the baby, so they avoid it. So as a doctor, you should explain this is very essential because this is high calories, which is rich in protein, and which is very much essential for the newborn. Not only that, it has antibacterial, the pharmacology content. I think there is a lecture on breastfeeding.
You said more calories, but it less carbohydrates.
But those calories comes in from the protein. Okay. Because for the baby, muscular building is more essential for the initial period. Okay. And the mineral content, I'm not going for this. So, the transition milk from first week. Oh, you're late. It's not supposed to be allowed. I'm not going to give both of the maintenance. No, I'm serious. I'm not going to give. Yeah, it's none of my business. Okay.
10 minutes.
So what? Note it down. I'm not going to give attendance. Alright. So from the 7th day to the 10th day, that initial, from the colostrum to the mature milk, the gap, the milk secreted, that is called transition milk. So the baby start to grow and the milk amount the volume start to increase. That is called mature milk. I'm not going deep about it. Mature milk, energy, what are the lipid contents, those things, again I'm not going to detail about it. There will be some lectures which states about the milk. Is that this block? It doesn't, no. What about oxytocin, those things that are, do we have in this block? No.
They make community lecture or not?
Which one?
You mean the other lecture?
Yeah, the other lectures. Okay. So I'm not going to going in details of the chemical components, those things that are which here. So what are the minerals? The most important thing about the breast milk is iron content. Which other vitamin is very less in breast milk?
What is?
Yes. Vitamin K. So the two important things which is very low in the breast milk is iron and vitamin K. Two things you remember. Now, this is again another common issue you come across when you are inshallah as a even within the pediatrician you are a neonatologist, you super specialty. So you completed a bachelor's, then master's in pediatrics, then super specialty in pediatrics as neonatologist inshallah. Okay? And you are sitting there, a preterm baby. Still you know what is the term?
Just breathe.
What is the meaning of term?
The
Term?
duration of pregnancy.
Full, which weeks to which weeks term? Any term?
28.
28.
No. 38. 38.
Term means from 38 to 42 weeks. Okay? Baby deliver from 38 to 48 weeks called term.
Before that,
Preterm, before that, preterm. After that, post-term. Okay? So you are a neonatologist, there is a preterm delivery 7 months or 8 months and the baby is very small. So mother what she will ask is, my breast milk alone not enough. She will ask to put the supplement nutrition like other things, formula feeding. Again, it's not recommended. The reason is, I'm sorry, the preterm milk has exactly what the baby, preterm baby need. Even if it is a preterm baby, the mother milk alone more than enough for how many months? 6 months. That word is called exclusive breastfeeding. I thought all of you know about it, but other than few people, everybody keep quiet. That's called exclusive breastfeeding. Okay, I thought of making it a discussion because the preterm milk has more of the following, which needs which exactly gives the requirement of the preterm baby, and it's less of calories, protein, calcium, phosphate techniques. Now we come to the second most important thing, a technique. You are now need not be neonatologist. In a primary health center where there is no central hospital, only the dispensary, and inshallah you are a chief doctor or a family physician sitting there. How will you recommend? Anyone can say in the back. What are the techniques you would suggest? What are the techniques you will even say? How will you suggest breastfeeding? If you say I will answer your attention. Okay? It just means preferably sitting
أنا لين ما أسوي توجه
okay, the right position there.
راح يتزوجون
Move your hand or clean, okay, that is for the supplement feeding. Move your hand, okay. Anyone can say yes from the left. What is the, how the mouth has to be?
This like this.
All available is the yes.
Exactly. Both hand and nipple has to be clean. Okay? You shouldn't use a chemical solvent. It has to be with the soap and water. Then you have to clean it properly. And no, not mine. Wait. I just show you. Okay, like this. Okay. Baby also should be warm, not wet. The reason is when the baby is wet, okay, it will not, the feeling of the baby, it will not feel to drink. That's the reason. And mothers should be relaxed, preferably sitting or in the lying down position. When you are feeding, the breast has to be supported.
And also the area should not be at the.
Sorry?
The area should not be at the.
Yeah, okay, let me go further. This is the endocrine, you know what will happen at oxytocin stimulation. They're not talking endocrine block.
Oxytocin.
Those things I you know about it. Okay. When you are giving the breastfeeding, you come across like the mother will come and say, my baby is not taking milk properly.
Yes.
Okay, and it is removing frequently, and a lot of complaints will come across, right? When you come across, you have to ask whether you are attaching properly or not. how will you identify, with her answer, you have to identify whether she is attaching properly or not. With these following signs. When it is attached, what are the signs? The mouth has to be widely open. The baby mouth, not the mother mouth. The baby mouth has to be widely open. And the lower lip, it has to be outside. And the chin, it has to touch the breast. Why? These are the signs shows the baby is very attached, very close to the breast. And the black portion of the breast not visible below the lower lip. You know what is that? The lower lip has to cover the areola. Okay? You know the breast structure, those things that are, nipple, areola and the tissue. So the areola has to cover, that lower lip has to cover completely. So most of the nipple and the areola has to be in the baby's mouth. The tongue, okay, the tongue of the mouth has to be under the areola. The reason if it is in the top, baby cannot suck. See, you can imagine, baby cannot suck. It will, the sucking force above the tongue, not below the tongue. So it has to be in those positions. These are the very essential when you are asking. When you are asking a mother, these are things you should. All right. Now, just I said, what are the different techniques from what are the techniques of proper breastfeeding? Okay. Okay.
And the black area, which is the area that is
Completely, most of the part has to be covered, and mouth has to be widely open. And the tongue has to be below the nipple and areola, the teeth. All right. This is very essential, inshallah, in future, even any position, okay, any level, like even a family physician or neonatal internal medicine. This is common even for your neighbor, for your relative, for your sisters. You should be able to give this advice to them properly. And I started with that. In the kingdom, the formula of feeding is very high. One of the highest formula of feeding in the world is the kingdom. Okay? And there is a wrong belief. The girl, you see the internet and the Google, the articles, the most common belief why they don't give the food, first number one is yeah. So the beauty, she thinks like if you feed the baby, so she loses her. But do you think like Allah might have given like this? No. What is that Quran says? How many years you have to feed?
2 years.
The recent research suggested what is that? You have to feed minimum 2 years. So, from 6 months supplementary feeding, from 6 months to 2 years, 6 months exclusive, from 6 months to 2 years, with the other things. After 2 years it's optional.
No.
After 2 years also you can feed.
Breastfeed?
Yes,
No, just to
read it. Okay. Nowhere it is mentioned maximum 2 years. Okay, it is mentioned 6 months is a exclusive breastfeeding. For 6 months to 2 years supplement. After 2 years it's up to your choice. This
About the
mean,
breast?
yes.
Now already after 2 months, 2 years, it's what?
Stop.
Yes.
Is it just don't see again minimum or maximum that word? Minimum duration, maximum.
You have the mother has to stop at 2 years.
Stop or has to give?
Has to stop at 2 years.
Are you sure, Muhammad? Has to stop at
You
2 years?
trust me?
Okay. Now, again the same thing in other side. Okay, let's come to the lecture. Let's go to the topic at the end. Okay. Okay. Let's go this topic again at the end. Okay. Now let's come to the next step. Incorrect. It's opposite of. Sometimes the mother will come to you like stating that my baby is not gaining weight, okay, and I am unable to feed properly. With the science, you have to understand opposite of the correct position. She may say this thing, mouth is not open and she is away from the breast. It means that it's not close to that. So sucking only the nipple, not the total part of the areola, only the nipple, okay? So these are the things of incorrect position. Now, how will you identify? Because initially she will really struggle. Like especially the first term in, she may identify different problems, and she may think sometimes that she is feeding properly. When she comes to you for the vaccination, you have to understand her breastfeeding, whether she is giving properly or not. How will you understand? What are the different criteria to identify whether it is adequate breastfeeding or not? So, it's very good. At least 8 times, at least minimum 8 times for 24 hours. The baby, after feeding, it will calm. It means that why the baby cry commonly? Due to hungry. Okay. Once you feed the baby, if the stomach is completely full and it will be calm. Usually 2 to 4 hours it will sleep after the feeding commonly. Okay. So 2 to 4 hours, average 3. It means that 24 divided by 3, 8. So 8 times per day it has to take. And it has the diaper. Minimum 6 times you have to change. Minimum 6 times in 24 hours. Diaper, why to change? Because of the urine. So every week the baby gains around 200 grams. So every month the baby gains around 4 weeks around 800 to 900 grams. Opposite to that, inadequate feeding. Adequate feeding, those are the criteria. Opposite to that adequate feeding is inadequate feeding. So weight gain is low, decreased amount of feeding, and opposite to that. Criteria of overfeeding. So it shouldn't be low, it shouldn't be high. Okay, it has to be proper. These are the criteria for overfeeding. It's very important thing, baby friendly hospital initiative. Alright. All the hospital, if you go there, if you go to pediatrics department, it is given by the WHO, World Health Organization. And what is UNICEF? Does anyone have any idea UNICEF? What is it, UNICEF? United Nation? I mean expansion for UNICEF. WHO, World Health Organization. Same like that, UNICEF? United Nation. Okay, United Nation. Next time we'll see. Okay. The first year, I told you what is the UNICEF when I took the lecture. The first year. So,
Certificate, international certificate.
International child. Then EF. Okay, read about it. Okay. There are 10. As per the WHO, as per the UNICEF thing, all the hospital, the pediatrics department, if you go to the primary health center, must have written in their local language, understanding all this policy. 1. Breastfeeding policy of the hospital, they follow. First it has to be their written policy. Not only that, whenever there is a policy, you have to train the staff to implement those policy. Then all the pregnant women, the breastfeeding, it's not like immediately after pregnancy time, you're not talking about breastfeeding. Once the delivery time, suddenly if you talk about breastfeeding, she will not understand it's important. So during the antenatal care itself, you should explain about the importance of breastfeeding. You should explain about the importance of breastfeeding, what is the advantage of it, what is the disadvantage of it, all those things. So when she has to start? When she has to start?
From
Immediately
first day.
after birth.
Yes.
Within half an hour of birth in case of normal delivery. Okay? When? Within half an hour in case of normal delivery. The most important, the fourth point is help mothers to initiate the breastfeeding when? Within half an hour. The fifth one is, simply if you explain the clinical skills, when the doctor simply explain how to do the breast examination, can you understand why you are taking video? You see how the doctor examining, all right? Okay, how he's not only he's teaching, after the clinical skills, teaching, lecture,